the Omicron variant of concern. Comme vous le savez,
As you
notre
know,
gouvernement
our
a rapidement mis en
was
place des
quick to put
mesures
measures
pour
in
ralentir
place
la
to
propagation
slow
de
the
ce
spread of
variant
this
au pays.
variant in Canada.
Nous voyons toutefois que dans de nombreux pays
However,
à travers le
we are
monde,
seeing that in many
la
countries
situation
around the
s'aggrave,
world, the situation is
quelques cas
worsening
se
and case numbers are increasing.
Countries around the world are seeing or projecting an important rise in the number of cases. Dr. Tam and Dr. New will speak to this as part of their modeling update in a few minutes. As a government, our objective is simple. We want to protect the health and safety of Canadians and protect the gains that we have made in the fight against COVID-19 over the last 20 months. This is why we have put into place new measures to mitigate, import, and slow the spread of the new variant in Canada. It's important to keep in mind that these measures might change as we adapt to this evolving situation.
As we announced on November 30th, we are gradually increasing our capacity to test travelers upon their arrival at the airport in Canada.
As announced on November 30th, we are gradually ramping up our testing capacity at international airports. Today, I would like to provide you with a brief quantitative update of that increasing testing capacity. On November 30th, our capacity for all air travelers from all countries was of 11,000 tests per day. As of yesterday, December 9th, that capacity has increased to 17,000 tests per day. The end state to test all non-US air travelers is a capacity of 23,000 nationally. We are therefore halfway. At the Vancouver International Airport, we've gone from 2,080 tests per day on November 30th to a capacity of 3,130 tests per day on December 9th. At the Calgary International Airport, we've gone from 910 tests per day on November 30th to 1,460 tests per day on December the 9th. At the Toronto Pearson International Airport, we've gone from 5,232 tests per day on November 30th to 8,317 tests capacity per day on December the 9th. At the Montreal Trudeau International Airport, we've gone from 2,128 tests per day on November 30th to 3,033 tests per day on December the 9th.
Now I will repeat this in French. On November 30th, our testing capacity at Canadian airports for all air travelers from all countries was 1,100 per day. Now we are at 17,000 tests per day, which is a little over a 50% increase. 23,000 is the capacity required to test all air travelers from other countries other than the United States, which means we are halfway. At the Vancouver International Airport, we went from 2,080 tests per day on November 30th to 3,130 tests on December 9th. At Calgary International Airport, we went from 910 tests per day on November 30th to 1,460 tests per day on December 9th. At Toronto Pearson International Airport, we went from 5,232 tests per day on November 30th to 8,317 tests per day on December 9th. At Montreal Trudeau International Airport, we went from 2,128 tests per day on November 30th to 3,033 tests per day on December 9th. As you can see, our testing capacity is increasing steadily and significantly, but it remains limited.
As you can see, our testing capacity is increasing steadily and significantly, but it still remains incomplete. In order to further increase our capacity quickly, we've awarded contracts to private companies, providing us with additional testing and processing services. These companies include Switch Health, Life Labs, and Dynacare.
These companies will help us to increase our capacity to test travelers upon arrival until we are able to test all targeted travelers as we announced on November 30th.
Once again, to anyone who is planning to travel, I will say this: you need to plan ahead. Be prepared for airport delays, have a quarantine plan, and be sure to use the ArriveCan application or website to submit your information before you arrive at the Canadian border. You should also be prepared for officials to follow up with you to make sure your COVID testing is complete. The goal of these measures is, and always has been, to protect the health and safety of all Canadians. Par ailleurs, mercredi, j'ai tenu une autre rencontre.
On Wednesday, I held another meeting with my provincial and territorial counterparts to keep them apprised of the evolving situation.
Today, I met with my provincial and territorial counterparts and provided them with another update on the ongoing situation. Over the course of the pandemic, our government has made significant investments in order to build testing capacity with the provincial and territorial healthcare systems. Through the Safe Restart Agreement, we have transferred over $3 billion to provinces and territories for testing and contact tracing. The federal government has also purchased 95 million rapid tests and shipped 86 million rapid tests to provinces and territories. Depuis le début de la pandémie,
since the beginning of the pandemic, our government has made significant investments to enable provinces and territories to develop their testing and contact tracing capacities.
à travers l'entente pour une relance sécuritaire,
Through the Safe Restart Agreement, we directly transferred over $3 billion to the provinces and territories. The Canadian government also purchased 95 million rapid tests, 86 million of which were directly shipped to provinces and territories. As you know, the provinces and territories' requests for these rapid tests also quickly increased. For a number of months, those tests were largely underutilized, but for the month of December, the province are hoping to receive approximately 35 million of them, which is about 5 times the tests that were unused over the past year. This is excellent news. And as we have always done since the beginning of the pandemic, we will respond to provincial and territorial requests, and we will assure that these tests will be shipped in time for the holidays.
Is growing. For the last year, these tests were largely underutilized, but for the month of December only, provinces and territories have requested around 35 million tests. This is very good news, and we will ensure that provinces and territories get these tests in time for the holidays. Finally, I would like to take a moment to come back to the National Advisory Committee on Immunization's recommendations from last week. As clearly stated by NACI, booster shots are safe and an effective way of enhancing our collective level of protection against the virus. I encourage all Canadians to get a booster shot as soon as it is possible. In our meeting on Wednesday, I reassured my provincial and territorial colleagues that the federal supply of vaccines is ready and available for them to use. Finally,
I would like to quickly come back to the National Advisory Committee on Immunization's recommendations. As the committee clearly indicated, boosters are a safe and effective way to increase our collective protection against the virus. All Canadians over 18 years of age can now have a booster shot as soon as possible, as the committee recommended.
In closing, I want to take a brief moment to take stock of the formidable progress we've made over the course of the last 20 months. It's been tough for all of us, et nous ne voulons pas revenir.
And we do not want to move backwards.
The Omicron variant of concern is a cruel reminder that the global epidemiological situation can change quickly. We all need to be prepared for that as well. At any given time, we may need to change gears, adjust our plans, or change our behavior to meet the needs of the moment. That goes both for individual Canadians and for their governments. Canadians who are thinking of traveling abroad need to be warned that the situation abroad is both risky and unstable. They should also know that returning to Canada will likely involve delays and hassle.
Now, I will open the floor for all questions and comments before we move on to Dr. New and Dr. Tam's presentation.
Very much, Minister Duclos. As you mentioned, Minister Duclos will be taking questions for about 30 minutes. Then Drs. Tam and New will present the modeling, and then they will take questions specifically on the modeling. Those who in the room who would like to ask a question will go to the microphones, and then after that we will go to the operator and people joining us by phone. First question, and when I call on you, can you tell me your name and your media organization? Mic to my right.
Bonjour, Louis Blouin.
Good day, Louis Blouin from Radio-Canada. Can you talk to us about numbers in the airports? What is your goal? When would you like to reach that 23,000 tests per day? Mr. Duclos. So we were at 11,000 tests in all Canadian airports for all international travelers, including those coming from the United States. Now we are at 17,000, so it's about a 50% increase, and we will need to reach the 23,000 per day as quickly as possible, which is why I gave that information on those three companies, which will be helping us to reach that $23,000 threshold as quickly as possible. Those figures might not be completely indicative of all of the progress that has been made over the past days, because if I may, as you know, I love numbers. 11,000 was the sum of all tests in all Canadian airports, but of that 11,000, about 3,000 were specific tests for air travelers from other countries than the United States, and it is for those travelers that we are investing efforts. We went from about 3,000, and we have already added about 6,000 to that basis of 3,000, which is a very significant increase, and we will keep working to meet the final result. Follow-up question. So do you know, as a matter of days or weeks or months, when that will happen? Secondly, there has been a change in dynamics with this Omicron variant. People are planning Christmas parties. Some are deciding whether or not they should cancel their trip down south. What is your recommendation? Should we avoid traveling or gathering? Can you send a clear message on that point? What do you advise? Answer. In a few moments, you will hear from Drs. Tam and New on the updated modeling and the forecast as well. We're observing that current cases, including in Quebec, are mostly with the Delta variant. Omicron is still very rare in Canada. And of course, that is thanks to our measures at the border. Of course, our measures are not perfect. We're hoping that they will work. And testing is sometimes inaccurate, as we know. And since tests are imperfect, travelers can still contribute to the spread of this virus in the country. But there were approximately 80 cases of Omicron in Canada at the last data. And this can help explain the significant increase in tests that we have been seeing in Canada. In Quebec, currently, we have the highest rate of new cases in the country. The Quebec government is doing its work properly. We're aiming to ensure that hospitalization rates are under control, but of course, we must remain vigilant, because there is generally a delay between the transmission of the virus and then later we see the increase in rates and hospitalization rates. Outside of Canada, the situation is evolving very rapidly. That is why my message is mainly regarding the international situation. My message is to people who are planning on traveling in the coming weeks. They must know that around the world, things can change rapidly. If you're following the numbers in Europe, it is getting very complicated in a number of countries. Certain countries have even asked school children to stay at home because the situation is deteriorating too quickly. In some countries, people had started to go back to work at their office, but they have been asked to stay home again. Things can evolve rapidly, and what I also try to express to people is that when people are trying to come back to Canada, that is also a time when things can change very quickly, and they must expect that things are going to get more complicated when it comes to traveling abroad and also coming back, and we are putting certain quarantine measures in place.
Saying good morning, Minister Duclos, Krisanashkate, CTV National News. Minister Marcy Ian is self-isolating at home after coming into contact at a gala in Toronto with people who have since tested positive. Should MPs and cabinet ministers be attending these large events given the rising case numbers? And have you had any contact with her on Parliament Hill this week, either in the House or at caucus?
Well, the answer here is that every Canadian, and certainly all parliamentarians, need to abide by the public health measures. Obviously, there are people who would naturally be more exposed to more people, and that's certainly the case of parliamentarians and public officials, including journalists. But whatever our role is in society, we need to be following public health advice. And when there is a risk or a likelihood that we have been in touch with someone infected, we absolutely need to follow the right public health guidance.
But you haven't been in contact with Marcy Ian at all?
Well, I will have to check the details of that story, and I can come back to you.
In Germany, it costs around €1 for a rapid test. In Ontario, it's $40 at Shoppers. Are you disappointed that provincial governments have not made the rapid tests you've given them more affordable and available for Canadians?
Well, we know it's been challenging for provinces and territories over the last year, and there's certainly no intention for me and for us here at the federal level to blame anyone. Experts have, however, said that we could have used rapid tests more often. This being said, experts also tell us that these rapid tests need to be used in a particular context, in a particular manner, in order to understand what they really can and cannot do. And two things that rapid tests can do quickly, and therefore things that rapid tests cannot do. The two things that rapid tests are quite good at is to provide what we call surveillance activities. So if in an environment like a school or hospital, a community center, a factory, there is no apparent sign of COVID-19, but we still want to be double certain, because it's a large community, then rapid tests are useful because they screen a lot of people rapidly, and they get very ample results of whether there might be community transmission or community occurrence within that particular context. Now, the second thing that the rapid test can do is if you feel symptoms and you want to have a rapid check of whether these symptoms are symptoms of COVID-19, and you take that rapid test immediately, and in 15 minutes you get the result. Now, if that result is negative or positive, doesn't matter. If you really feel symptoms that you may be contaminated with COVID-19, you need to take what is called a molecular or PCR test to validate that. But it gives you a quick idea of whether you should take immediate actions to isolate from others. So that's a useful tool, but not a complete tool, because you still want to be double certain by having a very precise molecular test. So these are the two main purposes for which the rapid test can be used.
Oops. Ashley Burke, CBC News.
Good morning, Minister Duclos. Same sort of question on the rapid tests. We're just hoping to find out, will the federal government continue to give rapid tests to provinces who are not distributing them widely and also freely to citizens?
Well, we've been providing these tests free, and we are continuing to do so. We are also multiplying by 5, just in December, the average delivery of rapid tests over the last month. So this is, and that's great. Now, we've been able to answer a relatively recent request from all provinces and territories to speed up the delivery of rapid tests. Now, so fortunately, we are able to do that and, in fact, match exactly the demand of PTs and provinces and territories for December, and we'll continue to do what we can to match further demands in the new year. This being said, how rapid tests are used in Canada in specific provinces and territories, that depends on the conditions and I would say priorities of provinces and territories. Like in Quebec just this morning, listening to the radio in my home city of Quebec, I was hearing that they were, and that's great news, they were distributing the rapid tests in daycare centers. In Ontario, they've been distributing them in schools and universities, I understand. In Saskatchewan, they've been making them available directly, I believe, through pharmacies to the general population. So there are different models that have evolved in Canada over the last few weeks. And what I hear from my colleagues, what I heard from them on Wednesday, is that they are looking at each other and trying to see what works best. No, they don't need to work in perfect synchronicity, but I think they're looking at each other and trying to do as well as the others are doing, taking again into account that they have different conditions, different partnerships, and different priorities.
But as you stated in your opening remarks, there have been a lot of unused tests in provinces and territories as well. What is your message to those regions who are not distributing them more widely?
My understanding is that, yes, there has been a significant amount of unused rapid tests for a relatively long period of time, but at this particular date, at this particular period in the history of COVID-19, so at this time now, the stocks in provinces and territories are relatively low, and that's why the delivery of these 35 million rapid tests is going to help.
Okay, Mike to my left.
Good morning, Tessie Sanchi with Hill Times Research. Minister Duclos, excuse me. I'd like to ask you about a separate matter that affects your office, which is drug pricing regulations that are supposed to be in effect on January 1. Your government has already delayed them 3 times. Can you say today on December 10 that those drug pricing regulations will be in effect on January 1, 2022?
Well, what I can say now is that we are obviously mindful of this important issue. I've been obviously in touch with some of the important stakeholders, including provinces and territories with which we need to work, and I will hopefully have something soon to say on the matter.
So you're not committing to them being in place on January 1, 2022. What would you say to stakeholders? It's been a bit of a hamster wheel, especially the last 2 delays. Folks have been getting notice 2 or 3 days, before the rules are supposed to be in place. What would you say to stakeholders who are just frustrated, whether they're for the rules or against the rules? They're not sure up until a few days whether or not there will be different rules in place.
Well, we understand, and I certainly understand that is a very important part of our overall efforts to reduce the costs and increase the access to medicines across Canada, including obviously the more costly medicines that have tended to emerge over the last years, almost all of them patented. So it's obviously an important piece of the agenda around making medicines less costly, more accessible, and also addressing the serious long-term challenges that we face in sustaining our healthcare expenditures over the next years. But I'll have more to say, hopefully, as quickly as is feasible.
Okay, Mike Lecouture, Global News.
Still introduce myself, if that's okay, Elizabeth. Mike Lecouture with Global News, Minister. Good to see you. I wanted to ask you, in light of what we're seeing with Omicron, not only around the world, but here in Canada, what is your advice to Canadians who are sitting around saying, I was promised that I can travel if I get double vaccinated, and I was promised that I can gather if I get double vaccinated? What are you going to tell Canadians? What is your message to them today about holiday travel and holiday gatherings?
maybe I should turn to Dr. Tam, who always, or Dr. New, who always say these things with greater eloquence and sometimes greater...
I'm sure they'll get the question later.
Okay,
but
well,
since you're here, I thought I'd ask you.
Very good. No, because I wouldn't want you to feel that I'm forgetting about Dr. Tam and Dr. New, but that you are telling me that you won't forget about them. Now, what we can tell Canadians is something that they've known since the beginning of COVID-19. COVID-19 is a virus and then a disease over which we have learned many things over the last 20 months, and that's going to be the same with the new variant. And the new variant tells us that we need to be even more vigilant when, in particular, we think about traveling outside of Canada. As we said earlier, Omicron is not yet prevalent in Canada, has limited community transmission. That is going to change. And you'll look at the modeling of Dr. Tam and Dr. New in a moment, you'll see how it could change relatively quickly. But it's not, the community transmission of Omicron now is limited, and therefore it's not, domestically speaking, what people should think about when they plan their holiday opportunities with friends and families. However, if they think about traveling outside of Canada, Omicron should be a big red part of their radar screen. No, it should be flashing, because things are happening very quickly outside of Canada. And so if they think of traveling, that should be a serious alarm bell, a serious concern for them, because it's not only about coming back to Canada, and when they come back to Canada, they should expect delays and hassle. That's going to be it, because we're going to do what we need to do to protect the health and safety of Canadians at airports. But they should also be mindful that it's going to be uncertain and risky to travel in a number of other countries over the next weeks, given the serious increase in the incidence of Omicron that we are seeing abroad.
I also want to follow up on the rapid tests. In one case, you had said that they've gone largely unused. You also said that you don't want to blame the provinces and territories for not using them, yet the federal government has delivered nearly $100 million to the provinces and territories. They're going largely unused. How can you not blame the provinces and territories for not using something that you have handed to them as a federal government to use more widely? Because they, as I said earlier, they have had to focus on priorities such as, vaccination and looking after the healthcare system, and the use of the most precise testing procedure, which is the molecular test. Now, when you have significant prevalence of the virus in a particular environment, molecular tests, that's what you need to use, because you don't want to miss anyone. So molecular testing has been, until now, probably the most important type of testing that we could use, because to protect the health and safety in environments where there is a lot of COVID-19 incidents, that's what you absolutely want to focus on. But now we've been moving to a different level of community transmission for some time. Obviously, things are changing in some of the provinces right now. But with that, we are now, in most provinces and territories, better able and certainly better guided to use the rapid test in appropriate circumstances.
Okay. Mike to my left.
Laura Osmond, the Canadian Press. Thanks so much for taking our questions this morning. My question is about this testing and mandatory quarantine policy for incoming travelers. The government's social media posts have been saying you will have to quarantine, you will be tested at the airport, as if this policy is fully enforced. You're saying we're only about halfway to the capacity that we need to fully enforce that policy. It's creating a lot of confusion for people who are worried about consequences for not following the rules when they don't really know what the rules are before they get to the airport. So what certainty can you give to people? What is their experience going to be if they're traveling in the next few weeks?
Well, there is one certainty, which is that the Canadians should expect to be tested and quarantined when they enter Canada through an airport from a place other than the United States. And they should expect that because, as we said earlier, we've made, not only was that present before November 30th, now I spoke about the 3,000 daily tests that air travelers were being administered randomly, but we've moved from that relatively small base, 3,000, and we've added 6,000 more tests, and we need to add another 6,000. So 3 plus 6 plus 6, plus 6 already, and 6 coming, that's, I think, will tell Canadians that the likelihood of having to be tested and quarantined when they come back into Canada, that likelihood is increasing quickly. Now, what they should also do is always listen to the directives of border officers and PHAC officers when they enter their particular point of entry into Canada.
I also want to ask you about domestic measures. I know we're not speaking about the modeling yet, but we can imagine that the effect of Omicron on our domestic case count could be very dramatic. And so you've been speaking with your counterparts at the provinces. I'm wondering, when this becomes no longer an international issue, if the Omicron variant does take hold in Canada, as the modeling no doubt predicts it could, what kind of domestic policies are you looking at with your fellow ministers in the provinces to limit the spread here?
Until now, and Dr. Tam might step in if you want, if you allow that to happen. Until now, the public health measures that have been understood and applied for almost 20 months now remain exactly those that we need to follow with the new variants. Social distancing, personal protective equipment, washing hands, watching symptoms, being tested if we've been in contact with someone possibly infected or if we have symptoms. So those are the fundamental public health measures that I understand need to continue as long as the variant, the virus is with us. I might turn to Dr. Tam just to say whether Dr. Tam have said something that he would have said otherwise.
Yeah, we know the public health measures that do work, and they will work against any variant. But we will go into things in a little bit more detail later. Thank you.
Thank you very much. Now we're going to go to the phones. It'll be one question, one follow-up, and the shorter the questions and the shorter the answers, the more people we can get in, because Minister Duclos does have a plane to catch. We want to get as many people a chance to ask a question as possible. Operator?
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning, Minister. Thanks for taking our questions. I just wanted to follow up on just one data point. You said today that testing capacity has increased 50%. Earlier this week, you were saying 60%. So just to clarify, so it is now 50%? And to Louis Blouin's question, when are we actually going to be fully there? You're saying these are necessary steps. So when are we actually going to have that fully in place? Will we be able to have it fully in place?
Thank you. And yeah, I understand that these percentages can be confusing. The overall, there are two pieces. The one piece is air travel. The other piece is land travel. So if we add land and air travel together, all the tests at land and at airport, as we said earlier, we need to increase that total testing capacity by 60%. Now, if we focus only on air travel, we were at 11,000 on November the 30th. We're now at 7,000, so it's an increase by about 50%. We need to go to 23,000. That's for just air travel test.
Marika, do you have a follow-up?
Yes, I do. Thank you. So going on to your comments about travel being risky and unstable, or that the situation abroad is both risky and unstable, as I think is the terms that you used. Are you planning to change the advisory that is currently in place that Canadians who are fully vaccinated can travel? You seem to be strongly warning against travel, but the official advice appears unchanged. So can you just clarify which advice Canadians should be following? Is it safe if you are fully vaccinated to travel, or will the government be changing its formal advice?
The advice that we're using is a combination of the advice of public health officials within Canada and that the advice coming from international partners, including the advice that comes from informational flows that they transfer to us, so we understand better, obviously, the situation outside of Canada when we have great collaboration with our partner countries on what they see on the ground. So it's a combination of what experts here tell us and what we hear from others outside of Canada. So it's a combination of these two, and the resulting advice to Canadians therefore changes as the situation evolves. The main advice is to be extremely prudent when it comes to thinking about traveling outside of Canada. We're not currently advising Canadians not to travel. That could come, and if it does come, it will have to come through a combination of different input, as I said, in different sorts of advice. But what we see now, what we hear now from public health officials in Canada and from the international context, is that people need to be very aware that traveling outside of Canada, as I said, comes with risk and uncertainty, and things can change quite rapidly.
Okay, next question, operator. And if I am serious about if people can ask questions quickly, then we will be able to get more people in, because unless the minister can stay later than I've been told, we've only got 5 minutes left.
Next question from Boris Proulx from Le Devoir. Minister, 6,000 tests missing. What is going on with that? Those missing 6,000 tests, there are travelers coming in without getting tested? Minister Duclos, two things are happening. First of all, there has been incomplete capacity until now, even though, as we've said over the past days, we have ramped it up significantly. Secondly, there is always prioritization of the allocation of these tests, whether it be at the land border or at airports. People arriving from abroad have been tested randomly, yes, but it has also been not random, because we have paid attention to the risks that these people could be carrying the virus. Follow-up question, do you have an idea of the percentage of how many people have been carrying the virus out of the test? Answer, I will leave that to the doctors, because that information changes rapidly.
Boris, est-ce que c'est possible d'avoir la réponse dans la deuxième partie de la conférence de presse?
Could we give you the rest of that answer in the second part of the press conference? Yes.
The next question is from Alex Balingal from the Toronto Star. Please go ahead.
Hi, thanks very much. I just want to clarify, Minister Duclos, you said that you expect the transmission of Omicron inside Canada will change, or the community transmission will change, if I heard correctly. Can you just clarify what you mean? Are you guys expecting that despite these border measures and the testing capacity and all the things you're doing to try and prevent more cases from entering Canada, that community transmission of this variant will increase?
Well, the answer is yes, community transmission it will increase, and in fact, it's an important feature of the presentation you'll hear very soon from Dr. Tam and Dr. New.
So just quickly as a follow-up then, so what is driving that? If we're focusing on the border, what do we need to do to try and prevent that increase? Are we doing enough? Why are we expecting it to increase?
Our border measures are probably the most effective of all measures around the world. Now we can always do better, but we've done extremely well compared to many other countries. And the reason is that we have multiple layers. The first layer is the pre-arrival test. Now, every traveler entering into Canada by land or by air needs to have a pre-arrival test. Now, the government has been criticized for that for some time. No, we should not have a pre-arrival test, but that's an absolutely central feature of our border measures right now, and this was going to be maintained. The second layer is the arrival test. That has always been there, but we're in a partial randomized manner. And now what we're doing right now is to make it complete for an important portion of air traveling. Then we have quarantine obligations that we have had since the beginning of COVID-19. And these measures, not only have they been maintained in many contexts since the beginning of COVID-19, but they were absent in many other countries. And that's another reason for which we have been extremely good through limiting importations of the virus and now the variant compared to many other countries. This being said, as we mentioned earlier, these tests and these procedures are by definition imperfect. So although they delay very significantly the importation of the virus and the variant, they are not going to stop the variant and the virus from entering into Canada. And that's why community transmission, although quite limited now, is going to be a challenge when the variant becomes more prevalent. But on that, again, it will be useful to hear and to turn to Dr. Tam and Dr. New.
Okay, we have a couple of minutes left. Operator, next question.
La prochaine question de Annie Guillemette.
Next question from Annie Guillemette. Over to you. Thank you. Good day, Minister. A few times you mentioned travels. I'd like to hear you in French on your official recommendation. You told Louis Blouin that things are changing quickly. But where are we on the government's official recommendation? Answer. Well, what we're telling people is that in Canada, at this time, there is very little Omicron spread. But abroad, in many countries where people may be hoping to travel, the situation is changing very quickly, and risks are doubled. Number one, people may go abroad and find themselves in very difficult situations because measures in other countries can change very quickly. And we saw this happening over the past 20 months with COVID-19. The second risk is when people come back to Canada. They will face procedures at the border. These measures take time. There will be delays. They may need to quarantine for a certain number of days. It may be many days because we may need to be strict and severe in order to protect Canadians' health. So people must be aware of that double risk when they are abroad and when they come back to Canada, which again is a time when they may face delays because of procedures. Follow-up. So there is no recommendation not to travel currently. Second question, on the delivery of rapid tests, should we trust manufacturers and companies because provinces and territories, regarding provinces and territories, shipment dates? Answer. The situation is going very well. I spoke with Mr. Dubé in Quebec. The province of Quebec has requested the number of tests it needs, and those tests, 10 million to be exact, will be delivered in time for the holidays. Some will be sent to childcare services. Those come from the Government of Canada, and the Government of Quebec will use them, including in those childcare centers for young children and young families. And other tests will be delivered over the coming days in order to attain that requested number of 10,000 tests to be delivered to Quebec. And it is the same for other provinces and territories. Remember, those 35 million tests that we have promised to deliver is 5 times the tests that went unused. We're working very well together, and I congratulate all of my counterparts in the provinces and territories because over the past weeks we have done great work and have succeeded in significantly increasing the number of tests that will be available for families and people in Quebec and elsewhere. Thank you, Minister Duclos.
The Minister has to bid adieu to us because he has his plane. So hold on, and we will be turning to Drs. Tam and New. Yes.
Jean-Yves Duclos talking about new measures to slow the spread of this new variant of the COVID virus, Omicron. So,
hello, everyone.
We are now going to listen to the Chief Public Health Officer of Canada, Theresa Tam, with some modeling data live here on CBC News Network.
As we head into the holiday season, we are faced with some new challenges, both in terms of renewed epidemic growth of the Delta-driven wave in Canada and the emergence and rapid spread of the Omicron variant of concern globally. At the same time, we've made important advancements by increasing our protection with vaccines and strengthening the measures we have available to reduce spread. Although uncertainties remain regarding the potential impact of Omicron, we know that maintaining these measures continues to be essential to the pandemic response in Canada, heeding public health advice, completing our primary series of COVID-19 vaccines, getting a booster shot when eligible, and keeping up with the basic personal precautions like wearing a well-fitted, well-constructed face mask, avoid crowding, improve ventilation, and other layers of protection continue to be our best and safest way forward.
Bonjour à toutes et à tous.
Good day, everyone.
Aujourd'hui, nous ferons le point sur les
Today,
travaux
we'll provide
d'épidémiologie
the
et
latest
des
update
modélisations
on the
effectuées
national
au pays
epidemiology
qui
and
orientent la
modeling
gestion
work
continue de
that
la
informs the
COVID-19 au
ongoing
Canada.
management of the
À l'approche de la
COVID-19
saison des
situation
fêtes,
in
nous
Canada.
faisons face à des
As
nouveaux
we head
défis,
into the
à
holiday
savoir
season,
une
we are
nouvelle
faced with
croissance
some
de la
new
vague
challenges,
provoquée par le variant
both
Delta
in
au
terms
Canada,
of renewed
ainsi que
epidemic growth
l'émergence et la propagation
and of the
rapide du
Delta-driven
variant
wave in
préoccupant
Canada and
Omicron
the
dans le
emergence
monde.
and rapid spread
Cela
of the
dit, nous
Omicron
avons
variant
réalisé
of
des
concern
progrès importants
globally.
en augmentant
We
la
have made
protection
important
conférée
advances
par les
by
vaccins
increasing our
et en
protection
renforçant
with
les mesures à
vaccines
notre disposition
and strengthening
pour
the
réduire la
measures we have
propagation.
available to reduce spread.
Bien que des questions demeurent quant à l'impact possible du
Although
variant Omicron, nous
uncertainties
savons que le
remain
maintien de ces mesures
regarding the
reste
potential
essentiel
impact of
pour la lutte
Omicron,
contre la
we
pandémie
know
au
that
Canada.
maintaining these measures
Le respect des
continues to be
conseils de santé
essential to the
publique,
pandemic response in
l'obtention de la
Canada.
série primaire du vaccin
Heeding
contre le
public health
COVID-19,
advice,
obtenir
completing
une dose
our
de rappel
primary
pour les
series of
personnes
COVID-19
admissibles et le
vaccines,
maintien
getting a
des
booster
mesures de
dose when
précaution
eligible, and
personnelles
keeping
de
up with
base,
basic
comme
personal
porter un masque
precautions
bien
like wearing
conçu
a
et bien
well-fitted,
ajusté,
well-constructed
éviter les
face
foules,
mask,
améliorer la
avoiding crowding,
ventilation et
and
adopter
improving
d'autres
ventilation
moyens de
and other
protection
layers of protection
continue d'être la
continue to
façon la
be
plus
our
efficace
best and
et la plus
safest
sûre d'aller
way
de l'avant.
forward.
On slide 1, since the last epidemiology and modeling update in November, the trend in average daily case counts has shifted from a decline to a gradual but steady increase. Over the past week, there were an average of over 3,300 new cases being reported daily across Canada. With daily new cases increasing, there is concern that national severity trends could begin to rise again. On average, in the past week, over 1,460 people with COVID-19 were being treated in our hospitals each day, including over 450 in intensive care units, and 20 deaths were reported daily. As we head into the winter months with a strained health system in many areas of the country, a high degree of caution is needed to minimize spread and impact, particularly during the upcoming holiday season.
Diapositive 2.
Slide
La situation vécue
2.
dans les 6 provinces les plus populeuses illustre les
These 6
variations
most populous
constantes
provinces
quant à
illustrate
l'activité de
some
la
of the
maladie
ongoing
pendant la
variation
4e vague
in
au
disease
cours
activity
au Canada.
experienced
Bien que
during
l'activité
Canada's
de la
ongoing
maladie
fourth
ait
wave.
diminué dans de nombreuses
While
régions
disease activity
durement
has
touchées par la
declined
4e
in many
vague,
areas
les
that have been
données
hard
tardifs
hit
sur les
during the fourth wave,
hospitalisations,
lagging
les admissions aux soins
hospitalization and critical
intensifs
care numbers
continuent
remain
d'indiquer
elevated,
que le nombre
and
de
the
cas
health
est
system
élevé et que le système de
is
santé
heavily
est poussé
strained.
à sa limite.
Not shown are other areas of the country where disease spread was well contained during previous waves of the pandemic, but where repeated introductions of the rapidly spreading Delta variant has resulted in outbreaks and community spread that continue to be challenging to control.
Slide 3, our RT, the reproduction number, has been relatively unstable due to considerable regional variations in disease activity and day-to-day reporting fluctuations. However, nationally, the RT has remained above 1 for over 5 weeks, indicating that the epidemic is in a growth pattern.
Diapositive 4.
Slide 4. Over the course of the third and fourth waves of the pandemic, incidence rates have been increasing among children under 12 years of age, many of whom were not eligible for COVID-19 vaccination until the recent approval of a COVID-19 vaccine for 5 to 11-year-olds. Rollout of pediatric vaccination programs provides an important additional protection option to reduce high infection rates in this age group. In addition to providing direct protection against symptomatic or potentially severe illness, vaccination of young children can help reduce spread into schools and beyond. Now that 95% of the population is eligible for vaccination, there are additional indirect benefits of further increasing total population coverage. These include easing strain across the health system and limiting spread within families and communities to better protect children under 5 years of age who are too young to be vaccinated. In particular, it continues to be important for parents and eligible close contacts of children under 5 years of age to get fully vaccinated and receive a booster dose as recommended, which can contribute to their protection.
Slide 5. This graph of cases associated with school and childcare outbreaks in Ontario and Quebec represents about half of the Canadian population, shows 5 to 11-year-olds remain the most prominent age group in these settings. However, encouragingly, several key features of the outbreaks involving children indicate sensitive monitoring and a positive impact of vaccination and infection prevention control measures that are being employed to keep these settings safer, while striving to keep them open for the benefit of children. Ongoing monitoring during the fourth wave indicates most school and childcare outbreaks involving youth have been small, with fewer than 5 cases. Compared to the third wave, there were fewer school outbreaks associated cases occurring in the 12 to 17-year age group, which are increasingly well vaccinated. Outbreak activity in schools mirrors community trends, and vaccination of household members can help prevent spread to young children and subsequent introduction into schools. COVID-19 cases among children most often do not involve severe illness. To date, there have been over 380,000 reported cases in children and youth up to 19 years of age, with less than 1% involving severe illness.
Diapositive 6.
Slide 6. While widespread circulation of the highly contagious Delta variant continues to be the dominant concern in Canada and many countries worldwide, recent emergence and spread of the Omicron variant of concern is a reminder how quickly things can shift in this pandemic. Together with health authorities and experts worldwide, we are closely monitoring key characteristics of the Omicron variant, including transmissibility, severity, and impact on immunity. To date, it appears the Omicron variant has the potential to spread much faster than the highly transmissible Delta variant. At this time, it is not known whether there is a higher or lower risk of severe illness and death with this new variant, but it is possible that a larger overall number of cases could impact healthcare capacity. Likewise, vaccine effectiveness is under investigation. The Omicron variant may decrease vaccine protection against infection, but some level of protection against severe disease is likely to remain. As well, the Omicron variant may be able to escape immunity from prior infection. Regardless of the variant circulating, vaccination, in combination with timed and targeted public health measures and individual protective practices, continue to be important for slowing COVID-19 infection rates and help reduce the impact of healthcare capacity.
Slide 7. The Delta variant continues to circulate widely and is still associated with the vast majority of new infections reported in Canada. However, incidence varies considerably across health regions. Health regions that have achieved high vaccination coverage while maintaining public health measures continue to be in a stronger position for this winter respiratory season. And with the recent emergence and spread of the Omicron variant, including detections in most jurisdictions across Canada, we need to maintain a high degree of caution everywhere. As of December the 9th, there have been 87 confirmed cases of Omicron reported in 7 jurisdictions. Although most of the initial cases were detected in recent international travelers or their close contacts, cases with no known links to travel have been reported more recently, which may be indicative of community transmission. Fortunately, to date, all reported cases of Omicron in Canada have been asymptomatic or mild. Public health authorities and laboratories continue to closely monitor for additional cases in Canada and to assess symptoms and potential severity.
Diapositive 8.
Slide 8. Recent approval of pediatric COVID-19 vaccines for 5 to 11-year-olds in Canada means that 95% of the total Canadian population is now eligible for vaccination. Since some 11-year-olds with a 12th birthday in 2021 received off-label vaccinations as part of the 12 to 17-year-old program, the 5 to 11-year-old age group has already achieved 17% coverage with at least 1 dose, and 1% are fully vaccinated. Overall, more than 62.5 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December 2020, providing over 81% of the total population with at least 1 dose of the COVID-19 vaccine, and over 76% of Canadians are fully vaccinated. As well, over 2 million COVID-19 vaccine third doses have been given, which includes booster doses. Likewise, vaccine coverage has continued to increase across all age groups, reaching over 88 to 95% fully vaccinated coverage in adults aged 50 years or older, and 82 to 86% fully vaccinated coverage in youth and adults aged 12 to 49 years. However, with the inclusion of 5 to 11-year-olds, there are currently over 7 million Canadians who are eligible but not yet fully vaccinated against COVID-19, so it's important we continue efforts to increase vaccine coverage to protect everyone we can.
Slide 9. Being fully vaccinated continues to provide substantial protection from severe illness, in particular younger people who are at lower overall risk of severe illness due to COVID-19 and develop stronger, longer-lasting immunity from vaccines than older adults have a substantially lower risk of hospitalization if they are fully vaccinated compared to being unvaccinated. Among youth and adults aged 12 to 59 years, unvaccinated people were 32 times more likely to be hospitalized with COVID-19 than fully vaccinated people. And even though older adults have relatively higher overall risk of developing severe illness and may have less robust response to vaccinations, being fully vaccinated still provides a clear and significant protection advantage against severe illness compared to not being vaccinated. Among adults aged 60 years or older, unvaccinated people were 16 times more likely to be hospitalized with COVID-19 than fully vaccinated people. As health authorities across Canada continues to monitor vaccine safety and effectiveness data, advice and programs are being regularly updated to ensure Canadians are provided and can maintain the best possible protection against COVID-19.
Diapositive 10.
Slide 10. This updated, longer-range forecast shows how the epidemic trajectory could evolve through mid-January, including potential trajectories with and without Delta replacement by Omicron. If we continue along the path we are on now, with our current levels of transmission, but without Omicron replacing Delta, we could expect to see a resurgence in cases along the dark gray line trajectory. If Omicron does not predominate over Delta, we could bring the epidemic under better control along the purple line trajectory by decreasing community-wide transmission by 15%. Alternatively, even if Delta continues to predominate, a 15% increase in transmission could result in rapid resurgence of cases along the blue line trajectory. However, if we assume the Omicron variant is 3 times more transmissible than Delta and becomes the dominant variant in Canada, it is possible that we could have a resurgence in cases along the rapidly accelerating orange line trajectory. While there is still a considerable uncertainty regarding the potential for Omicron to evade immunity and increase severity, rapid resurgence in cases could potentially strain our still fragile healthcare system. Although this forecast is concerning, we are reminded that models show only future possibilities, and that with fast and appropriate action, we can avoid a worst-case scenario trajectory, as we have done in the past. The speed of Omicron transmission and potential for strong resurgence means we must approach the coming weeks with an abundance of caution, and at the same time, we must be prepared to act quickly to control the spread at the first sign of rapidly accelerating cases. I would also like to call your attention to slide 17, which shows that a resurgence is expected for Ontario and Quebec currently. If Omicron replaces Delta, the resurgence will also be seen in other areas.
Thank you. Just to repeat what Dr. News just said, there is a slide 17 in your package that shows some of the regional forecasts, indicating that resurgence is forecasted in a number of regions if Omicron replaces Delta. So these scenarios on slide 11, these scenarios do not include the potential impacts on the Omicron, but aims to illustrate what could happen through 2022, taking into account the possibility of waning protection of vaccines. It is important to note that this model assumes a very significant waning of protection in order to better illustrate the potential impact of different vaccination strategies. The scenario on the left illustrates an extreme example to show what could happen if there was no vaccination of 5 to 11-year-olds and no boosters given to adults. In this scenario, the model shows there is a high risk of having a resurgence with the potential to exceed hospital capacity in 2022. In the middle scenario, which includes vaccinating 5 to 11-year-olds, but with still no boosters given to adults, the simulated scenario is improved, but resurgence could still occur. Lastly, in the scenario on the right, the combined effect of vaccinating 5 to 11-year-olds and giving booster doses to adults 18 years of age or older could significantly reduce the risk of resurgence in 2022 under the assumptions in the model. This scenario could therefore reduce the risk of exceeding hospital capacity in the months ahead. While these are just theoretical scenarios, this modeling highlights the importance of expanding and strengthening our vaccination programs to reduce the risk of strong resurgence.
Dear positive dues.
Slide 12. Experience of other countries continues to reinforce the need for very high vaccine coverage, together with sustained public health and individual measures to avoid a rapid resurgence where Delta is predominating, as well as to delay acceleration and replacement by the even more rapidly spreading Omicron variant. As with other countries in Europe, Germany's trajectory illustrates that despite previous success in controlling epidemic acceleration, easing of public health measures in the absence of very high vaccine coverage can lead to a strong resurgence of a Delta-driven wave, placing a heavy strain on healthcare capacity. As the Omicron variant begins to spread where the Delta variant is still predominating, countries like the United Kingdom illustrate the speed with which Omicron can take hold from first detections to rapid expansion of community spread. This cautions us of the high likelihood of Omicron replacing the Delta variant in a very short period of time. This is clearly illustrated by the near vertical spike in cases seen in South Africa as Omicron rapidly accelerated and replaced the Delta variant. Globally, the Omicron variant is spreading further and quickly. Community transmission is now being reported in many parts of the world, including many areas of the United States. In light of this, Canadians are urged to carefully consider the increased risks and high potential for disruptions associated with international travel over the holidays.
Slide 13. Despite the challenges ahead with the continuing Delta-driven wave in Canada and emergence of the Omicron variant, we have more and better protections going into this holiday and winter season than previously. This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and in intensive care daily. Most importantly, daily reported deaths are 82% lower than this time last year. Vaccines have given us substantial protection from infection and severe outcomes to date, dampening the impact of the Delta-driven wave this fall, which could have been many times more severe or required more stringent restrictions had it not been for the added protection of vaccines. Vaccines in our expanding coverage continue to give us an advantage over this virus, and while some reduction in protection is possible with the Omicron variant, COVID-19 vaccines are still expected to provide a level of protection, particularly against severe outcomes. As well, experts and health authorities continue to update our vaccination program advice, and we can better ensure that Canada's vaccines and vaccination programs continue to provide Canadians with the best possible protection. So, as we look to the holidays and weeks ahead, caution is still warranted. But as you consider the risk for you and yours, we can be thankful we're better protected with vaccines and have more choices to allow us to come together more safely. We're safer when everyone who is eligible is fully vaccinated, and if all who are eligible also get a COVID-19 booster dose. And regardless of our vaccination status, we can stay safer over the holidays by keeping up with the latest public health advice, taking precautions when in indoor spaces with others outside our immediate household, and using layers of protection to reduce risks, including wearing a well-constructed and well-fitted face mask, keeping gathering sizes smaller, and improving ventilation, maintaining our good habits with hand and cough hygiene, staying home and away from others if we're experiencing any symptoms, and getting a COVID test, especially if symptomatic or as recommended. The speed of Omicron transmission and potential for strong resurgence means we must approach the holidays and weeks beyond with an abundance of caution, while being prepared and following the advice of health authorities, who will need to act quickly to control spread at the first sign of rapidly accelerating cases. Thank you. Merci, Miigwech.
Et finalement, pour terminer, la diapositive 13.
And finally, slide 13. Despite the challenges ahead with the continuing Delta-driven wave in Canada and the emergence of the Omicron variant, we have more and better protections going into this holiday and winter season than previously. This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and intensive care daily. More importantly, daily reported deaths are 82% lower than this time last year. Vaccines have given us substantial protection from infection and from severe outcomes to date, dampening the impact of the Delta-driven wave this fall, which could have been many times more severe or could have required more stringent restrictions had it not been for the added protection of vaccines. Vaccines and our expanding coverage continue to give us an advantage over this virus. And while some reduction in protection is possible with the Omicron variant, COVID-19 vaccines are still expected to provide a level of protection, particularly against severe outcomes. As well, as experts and health authorities continue to update our vaccination program advice, we can better ensure that Canada's vaccines and vaccination programs continue to provide Canadians with the best possible protection. So, as we look to the holidays and the weeks ahead, caution is still warranted. But as you consider the risks for you and yours, we can be thankful we are better protected with vaccines, and we have more choices to allow us to come together more safely. We are safer when everyone who is eligible is fully vaccinated, and if all who are eligible also get a COVID-19 booster dose. And regardless of our vaccination status, we can stay safer over the holidays by keeping up with the latest public health advice, by taking precautions when we are in indoor spaces with others outside of our immediate household, and using layers of protection to reduce risks. Layers of protection include wearing a well-constructed and well-fitted face mask, keeping gathering sizes smaller and improving ventilation, maintaining our good habits with hand and cough hygiene, staying home and away from others if we're experiencing any symptoms, and getting a COVID-19 test, especially if symptomatic or as recommended. The speed of Omicron transmission and potential for strong resurgence means we must approach the holidays and the weeks beyond that with an abundance of caution, while being prepared and following the advice of health authorities, because they will need to act quickly to control spread at the first sign of rapidly accelerating cases. Thank you. Merci, Miigwech.
Thank you. It's time for questions. We will start with questions in the room. Those who want to ask a question, go to the mic, and then we will go to questions on the phone. It's one question, one follow-up. First question to Mike Le Couture, Global.
Doctors, thank you for taking the time to take our questions. In light of the modeling you've just presented and the warning of prudence, there are a number of Canadians who have followed a lot of these briefings and who have done everything you've said, got double vaxxed, and with the promise of, if you get double vaxxed, you'll be able to do more things. And we know things have changed. But what is your message to Canadians who have this feeling of invincibility because they did get double vaxxed and feel like, I should be able to gather, I should be able to travel? With everything that you're presenting right now, what is your clear message to them about making decisions in the next 2 weeks to either have a gathering at home or travel?
This is Theresa Tam. Maybe I'll start. So getting the vaccine is still the most important layer of protection, and people should still get it if you haven't, and get a booster shot, particularly people over the age of 50. And that is still key advice. because what we are seeing is that vaccines are still very good at very good at protecting you against severe outcomes. So that's really important to do. In terms of the time period ahead and going into the holiday period, it is actually, of course, really difficult for people to think, well, we've done all these things. We're really looking forward to a giant party. And now you're telling us that there's another variant. I've been saying that the winter period is going to be a bumpy road towards a brighter spring, if you like. So this is another bump on the road, and we still don't know enough about the Omicron variant, except that it looks like it's very transmissible. So I think that keeping private gatherings small is actually quite important at this point while we learn more. I think that you can still have a really good time by linking with family or your immediate friends, and so that you can do this safer. Gathering with smaller number of people in well-ventilated places, all of those layers of protection we just talked about can still enable you to have a good time while being safer and being precautionary. Of course, gathering with vaccinated people is still going to be safer than gathering with unvaccinated people. But if you've seen some of the news about this Omicron variant, is that vaccinated people could still get infected. So you just need to be mindful of that. In terms of travel, I think that traveling within Canada at this point in time means that you're likely to have a much better experience than if you're heading into the international destinations. So I think if you haven't actually booked any of these trips, staying closer to home, I think is definitely the better choice. And if you have already booked your trips, as the minister said, things can change very rapidly in the international context. Right now, and every hour, there's a different number, but what I do know is 61 countries, as of last night at least, have already confirmed that they have the Omicron variant, and some of them haven't detected widespread community transmission. But still, because of that uncertainty, people need to take it into account, not just because of your risk of getting infected, but the risk of all the different rules that might be fluctuating in the international context.
Thank you for that. Dr. New. I just underline that the main points that Dr. Tam has already put forward. If you look at this sort of holiday season compared to last holiday season, I think it really, it's a bit different, obviously, because we have the vaccines and they're a great tool. So I think to underline the point again, try to ensure as much as possible that if you have any family gatherings, that everyone's vaccinated, and if obviously if you're eligible, get that sort of a booster dose. So that's number one. And of course now the kids 5 to 11 are also eligible to get a vaccine. So that's great. But all the other proven public health measures that we've been repeating so often about face masks and so on, I think we need to double down on that. I think people, you're right, maybe have been reassured because of the vaccines and how well they've worked that, okay, maybe I don't need my face mask. But, there's emerging evidence that, with the new variants, they're so much more transmissible, and even people who are fully vaccinated can still, get infected and pass it on. So if you have a family gathering, as Dr. Tam said, try and keep it small. Maybe there's a good discussion to be had about people, even fully vaccinated, still wearing their face masks indoors, obviously well-fitted, well-made, and so on. And then the other part about ventilation, we talked about it, previously, but it's maybe something to consider this holiday season. I know it's the winter, but maybe, having a window open maybe for a certain amount of time, on the hour, et cetera, just can help, the circulation of the virus sort of dissipate. So those are sort of practical things you can do. And then, of course, all the other things about good hand hygiene, of course, don't even think of hopefully, getting together with people if you're sick and staying home. I think all that applies. For international travel, it's the same thing. Take a serious look at, your vaccine status. If you are maybe in a certain age group that has underlying, health issues, other conditions that put you at higher risk of severe consequences, I think you should really think twice, even if you're fully vaccinated. Then, of course, as Dr. Tam said, looking around the world, it's the pandemic's raging in many countries around the world that haven't been so fortunate as ourselves in terms of their vaccine coverage and sort of the use of public health measures. And so it really, I think, behooves you to take a careful look. What is the vaccine coverage? What is the epidemiology if you're still planning to go overseas and take a careful look. And as we all know, the situation can change rapidly. If, let's say, there's widespread community transmission suddenly occurring in a country that you might be wanting to go to, then the local authorities might put in measures that maybe aren't in place now. And of course, coming back to Canada, certainly we're trying to do what we can to slow the spread of the vaccine in Canada with what we're doing at our border with testing and quarantine. So those are all the things to think about, and hopefully Canadians can take that to heart and plan accordingly. Thank you.
Thank you for those fulsome answers. I just wanted to sort of pick up on the sentiment out there and Canadians and how, despite being fully vaccinated now, where you guys are looking at Omicron right now and the potential of having to bring back in or at least suggest lockdowns or different other restrictions, how worried are you about how those could be received when you consider the fatigue that is being experienced by Canadians who feel invincible being fully vaxxed, because that's exactly what you said Canadians should do, and how are you weighing that as you look at the curves and how you're trying to stop Omicron from taking hold here in Canada?
It's Teresa Tam. I'll take that. So I think people should take heart in that, as you've seen, even if you go back to one of the first slides, slide 2 or something like that, on the different curves, what is most striking is the reduction in deaths and some of the severe outcomes. So I think people should bear that in mind. This is a gift that we did not have last year. And I think focusing on and how much that has given us. It is tough, and this virus keeps dealing us the next card in the deck. And sometimes, it is difficult to imagine, but we can get through this. I am still optimistic. This is another bump. I think we should, I certainly feel better about not getting severe outcomes from definitely the Delta virus. We still have to learn more about the Omicron virus in terms of severity. But I think why we're asking for caution is that when that curve takes off, and it can take off very rapidly, as you've seen in the United Kingdom, even lower severity impacts can result in a large number of people ending up in the hospital. So we just want to keep things smoothed out and manageable. And so I think we're asking for everyone to collaborate so that you don't have to close schools and do all those things. This year is very different. Look at this fall compared to last. We've had the ability to ensure people are back in those essential work, school, and economic spaces. Let's try and keep it that way.
Bonjour, une question pour le docteur
Louis Blouin, Radio-Canada. Hi, I have a question for Dr. New. The first question has a number of components. In your opinion, what is the probability that the Omicron variant become the predominant variant in Canada? We're getting certain messages suggesting that it's inevitable. And secondly, what would life look like if Omicron became the dominant variant? And what would the health measures look like that would need to be taken afterwards? Dr. New, thank you for the question. It's a good question. Currently, we're continuing to gather data with our partners around the world to answer 3 important questions regarding the variant of concern. 1, transmissibility, severity of disease, and the efficacy of vaccines against it. We are seeing that it is even more spreadable than the Delta variant. But for the other 2 points, we still do not know. We will have to follow them closely, looking at the situation here in Canada and around the world. Regarding European countries, it is possible the Omicron variant will be the predominant variant in even the space of the next few weeks. We're also observing what's happening in the UK and Germany. And the same thing could be possible in Canada. That is why we must continue with our measures at the border and also must continue working together with other countries to take the best measures to reduce the spread as much as possible. Here in Canada, to date, we are seeing that cases have been asymptomatic or the symptoms have been light symptoms. But we must not be too optimistic, we must be prudent, and we must continue to use all health measures available to us, including vaccines, to slow the spread. But it is always possible. Things we are seeing abroad could happen in Canada. We cannot say that the Omicron will not become the predominant variant. We must continue with vaccines and public health measures. Follow-up question. You're saying that there's been a resurgence in Quebec and Ontario, and these are two provinces that have advised that it's okay to increase gathering numbers over the holidays. You yourselves were speaking about decreasing gathering size. So what is your advice? What would be reasonable? Answer. Well, we always have our personal opinions, but here's what I can tell you. In the provinces of Ontario and Quebec, we have counterparts and we are always in close communication with them. That also goes for other provinces and territories across Canada. We are closely following epidemiological situations in each region, so that measures can be adapted as the situation evolves. Provinces could adjust measures in the coming months or weeks. In my opinion, I think smaller gatherings would be advisable. I don't think it's advisable to gather in groups of 20 or 25. What do I mean by a smaller group? Well, perhaps more like a gathering of 10 people. This must be decided while considering the regional epidemiological situation. So in one city or town, it's very important to follow local public health measures. I have my own opinions, which I will apply to gatherings within my family, but I will also follow advice from local health authorities. Thank you.
Thank you. Kristen Agakute, sorry for that, CTV.
Thanks, doctors, for taking our questions. On slide 11, it shows that if vaccinations are offered for kids 5 to 11 and boosters are offered to 18 plus, cases will not exceed hospital capacity. Why is NACI not giving a strong recommendation that all 18 plus be eligible for boosters right now?
I think NACI has recommended that boosters be offered to 18 plus, but the focus, and if your objective is to reduce serious outcomes, the key focus still remains the older age groups and the other higher risk populations. So I think for systematic rollout, but also because there's a recommendation at this point to maximize the immune response and using a interval of 6 months or more, which means that if you do a systematic rollout from when you had your last dose, it actually just works out logistically and programmatic planning perspective that the younger age groups will come a bit later. So I know that all provinces and territories are focused on getting the older age groups and the higher risk groups vaccinated right now. That's just the priority. But I think all of them are committed to essentially moving towards everybody getting their booster. Of course, with the Omicron variant, we are still awaiting some of the further information on its impact on vaccines.
And my second question, Dr. Tam, you mentioned there is now community spread of the Omicron variant, so travel restrictions will likely not be enough to stop this spread. Will you recommend that provinces start putting in place more restrictions and gatherings to stop this community spread?
We have reports, and they're not many. There's the odd reports of people with Omicron who cannot be linked to a travel-related case. So that is a first sign of community spread. We haven't seen a major spread, or at least we haven't had it reported to date. So it depends on where you are, as it has been throughout the pandemic. The epidemiology can be quite different in different provinces, territories. So the local epidemiology absolutely will drive the response. And if you're seeing a rapid increase in cases, or there's a cluster of Omicron, then, as previously, my suggestion is act fast so that you can come out of it quicker. By acting fast now and making sure people are observing all these layers of protection, and keep your gathering sizes small, while we're still learning about this Omicron variant, is the most prudent thing to do. But it depends on where you are in the country.
Thank you. Ashley Burke, CBC.
Hi, Dr. Tam. What's it like for you to hear that there are claims that staff are neglecting those staying at designated quarantine facilities, complaints about a lack of food, lack of answers about what's going on, lack of medical help? Is that acceptable to you?
I think one must strive to be as as effective as possible, as supportive as possible for people who have to undertake quarantine, which is a difficult thing to do. So while I'm not directly involved in the operational aspects of the quarantine service, I do think that any of these incidences must be reported so that they can be prevented going forward. So, I think everything has to be done to support those who are in quarantine.
And do you believe that in light of what you presented today, that boosters need to happen immediately, not 6 months after you get a vaccine?
Well, I think we're still learning about the impact of the Omicron virus on vaccines. It's possible that, and quite likely that when you get a booster, your antibody levels, for example, one part of your immune response could get boosted. And there's some very early laboratory studies, including from manufacturers, that certainly suggest that a booster dose can increase that response. But some of the studies doesn't really indicate what happens to the rest of your immune system, and the vaccine effectiveness has not been determined. I think that, of course, we can shift recommendations, but right now, we know based on vaccinology and decades of knowledge on vaccines that if you want the best or optimize your schedule, then the intervals matter. So NACI's recommendation for that interval could then increase the quality and the duration of your immune response. So I think, of course, we will be meeting, NACI can examine the issue further, and the provinces will too, once we get a bit more information from, mainly from the international experience. And there's a large amount of studies being undertaken in laboratories, in animal studies, and I hope from Europe on the real life experience of the vaccines. The other thing that I'm trying to keep in mind is that this is not the only variant that is necessarily going to come along. So we can't just keep thinking of 2 weeks ahead. We have to think about the slightly longer term, not just Christmas, but towards March break. So how do we ensure that we give the best advice on the vaccine so that the durability of that response is as good as we get. So I think the concern is that if we boosted, which I think can increase your vaccine, can increase your neutralizing antibody levels, for example, that might not last for very long. And so all of these things are being weighed. But all I can say is go get your booster when it's your turn, and please do that, and particularly those at high risk.
Thank you. Laura Osmond, Canadian Press.
Hi, Dr. Tam. You touched on this a little bit already, but on slide 10, the possibilities you outlined there are quite intimidating. I'm wondering if you can speak a little bit about what you would project in terms of severe outcomes as those projections go way up. If Omicron were to take hold in Canada, what would you expect to see in terms of hospitalizations based on what we know right now?
Thank you. So what we don't know is the severity of illness from this particular variant. And we do not know the impact of vaccine effectiveness against severe outcomes. The earlier, very preliminary information coming out of South Africa and right now is that they've encountered more milder illness. And certainly the travelers that we've had coming into Canada with Omicron have had mild or asymptomatic illness. But we must not take that for granted right now. We need to wait and see because of the delay in seeing the severe outcomes from the initially infected cases. So that model doesn't model the severity. But even if the proportion of those who get Omicron who get severely ill is tiny, if you get enough cases, you'll still have enough severe outcomes to impact your hospitals and your ICUs. So I think that is the message. And so for now, while we're still learning about this virus, being precautionary will help protect your health system.
I think people just want to know exactly how concerned they should be, given that they're vaccinated, they're protected, they're following the basic public health rules. Omicron is like a big boogeyman at this point. Given what we know about the safety that we do have, how concerned are you for people's individual safety?
Well, I think we must stay informed and vigilant, but we shouldn't panic. We know many of the layers of protection that work for any variant. If it's a more transmissible variant, you do have to be more careful when you are putting on a mask. Make sure it fits. Get the best quality mask you can get your hands on. Improve on ventilation. So when there's a more transmissible virus, we've just got to pay even more meticulous attention to the things that we know already works. I think that's the key. We will learn more, and we will let you know, I think, as soon as possible when we do learn more about the impact of vaccines. But Delta is still 90-something% of our cases, and we know vaccines work for that variant. And so I think we stay on course for now, and we will obviously inform everyone when there's more information. I still think people should take heart in having personal agency. We know how to assess our own risk. We know how to assess the risk of a particular contact or gathering, and use all of that knowledge to our advantage. And just keep the transmission low so that it's not going vertical. When we keep it low, we can then learn more in the next weeks to come, and then we can take the next steps. But still, I think people should feel optimistic about the longer term outlook.
It's Dr. New, maybe I can just add to what Dr. Tam has said, and I think to your question, I think if I were to characterize, I think we should all, including myself, respect the virus. It's a formidable foe, and it's obviously evolving as we, fight against it. And so we just need to, I think, respect it, but not to panic and be scared. We have a great number of tools now, and we know much more about the virus. So with vaccines as a great tool to help protect against serious illness, and then also with all of the proven measures, the face masks and so on, because we know about much more about how the virus is transmitted and so on. I think we just need to be respectful and cautious, but like I say, not to be I say in sort of the panic mode, which I get the sense from your question, maybe some people are worried about. So hopefully that helps answer and hopefully give a level of assurance to the general population that, hey, we've dealt with this before when we first faced this virus, and we can do it again with all of the tools that are at our disposal. Thank you.
Thank you. Time to go to the phones for questions. It will be one question, one follow-up, and operator, if it's possible, to give precedence or preference to the members of the Parliamentary Press Gallery. Operator, first question.
Certainly. The next question is from Jimmy Murasha from Global News. Please go ahead.
You guys actually answered all my questions, so you can skip me.
That was fast. Operator, next question.
Thank you, merci. The next question is from Catherine Lévesque from La Presse Canadienne. La parole est à vous.
Oui, bonjour à vous tous.
Good day, everyone. Actually, my first question was asked to Minister Duclos, and we did not receive an answer. According to the Public Health Agency of Canada, when it comes to testing at airports for all travelers, except for those travelers coming from the United States, when will we be assured that all travelers will have been tested? Do you have an estimate? Is it a matter of days? What can you tell us on that? Answer, Dr. New here, and Dr. Tam can add anything later. I think, as Dr. Tam has already noted, neither of us are aware of operational details. We know what the goals are when it comes to testing, and we know what the rules are at our borders. And I said this earlier in another press conference. Measures at the border are to buy time and to delay the import and spread of the Omicron variant. This will give us a chance here in Canada, but also give other countries around the world a chance to collect and analyze data on the three big questions: spreadability, the severity of illness, and the efficacy of vaccines against the variant of concern. Testing is important, but in my opinion, the biggest question is what are the impacts? And we're observing the cases in Canada. That's very important to do, but we're also keeping an eye on what's going on around the world to better understand what the impacts are when it comes to community spread of the Omicron variant. We will continue with our efforts, and as the Minister noted, we will continue to ramp up capacity for border testing, but that is part of a range of public health tools at the border, but also within Canada to face this variant. Thank you very much. Follow-up question. I'd like to come back to Christmas gatherings. You were talking to my colleague about this, and you said that it isn't a good idea to have 20 or 25 people gathering because cases are increasing in Quebec and in Ontario, and it is exactly in those two provinces that we have been given permission to gather in groups of 20 or 25 around the holidays. Do you think those provinces should move backwards again, go back on their decisions before the holidays? Answer. Thank you for the question. As I said, I have my own personal opinion. I'm ready to make my own plans for a smaller, more intimate family gathering in my own case. Also, it is always very important to follow local public health advice. So even in the case of Ontario and Quebec, I think those provinces may still adjust their advice province-wide. But there's also flexibility in what local advice might be. I think everyone needs to remain flexible and aware that rapid changes to measures can happen. Everyone should keep apprised of local health advice. Thank you.
Operator, next question. Prochaine question.
Thank you. Merci. La prochaine question de
Thank you. Next question is from TVA, Olivier Ferrand-Boissé. Good day. I would like to come back to the graph regarding hospital capacity. So if we're 18 years of age or older and we have a third dose, or if everyone 5 to 11 years of age gets vaccinated, we've seen what the result would be. Can you tell us about shots for people 50 years of age and older? Here in Quebec, the booster will be given to people 60 years of age and older in January only. Do you think we should be moving more quickly? Answer. Thank you for the question. There are many questions, but we do not have all the answers regarding the Omicron variant. We don't know about the efficacy of the vaccine. But we still know that vaccines are the best tool that we can use. So we will continue to work to improve vaccine coverage, now including children between 5 and 11 years of age, and also increasing coverage, including vaccines, for vulnerable people, including seniors and including immunocompromised individuals. It's difficult to answer certain lingering questions just based on the data we have available to us at this time. But I will say that we must continue to be prudent. If the Omicron variant becomes the predominant variant, and even if the consequences or the symptoms are generally not severe for the majority of the population that is affected, if the rate does continue to increase of cases in general, then that will still likely lead to an impact on our healthcare system. This is why we are focused on increasing vaccine coverage, especially for priority eligible individuals. I think it's important for provinces to offer booster shots, and it's also important for us to keep an eye on what's happening with the spread of Omicron. But the Delta variant is still the predominant variant in Canada. Follow-up question. Thank you. Regarding Omicron, I understand that if it were to become the predominant variant in Canada, we will see a spike in cases. In Quebec and in Ontario, I'm having difficulty interpreting the curve of the trajectory. Can you compare Omicron and Delta for me? Will we see the same thing if Omicron becomes the predominant variant as we've seen for Delta? Answer. Thank you for the question. I am not an expert in modeling, but we have a number of experts who continue to monitor the situation closely. They attempt to determine what the estimated trajectories could be for the Omicron variant in the future, and they change out variants, for example, rates of contact within the community. And it is difficult to create these estimates. That is why we are working closely with our provincial and territorial partners to report cases of the Omicron variant to ensure effective contact tracing and to roll out our best efforts to slow the spread. It is always possible that despite our best efforts, we might be able to slow the spread, but we still do not know in the coming weeks or months, the situation that we will end up seeing could turn out to be entirely different. So we need to up vaccine rates and also not back down with our public health measures. Does Dr. Tam have anything to add? No? Okay, thank you. We always repeat the same things, I know, but it's because these public health measures are tried and true, they're proven to be effective, and the efficacy and the advantages of vaccines are very clear. Some Canadians still have not received even one dose of a vaccine, and I would say to them, now might be time to receive a shot of the vaccine, maybe a second shot, or a third shot as soon as we're all eligible.
Unfortunately, we don't have time for more questions.
Is there anyone left in the queue?
We have more questions.
No questions? Okay. Then this.
We do have more questions. I'm sorry, we're instructed not to take more questions, but we do have more questions.
How many people are still in the queue?
3.
Dr. New, Dr. Tam, are you able to take those 3 questions?
Yes, I'm okay with that. Thank you.
Okay.
Yes.
Operator, next question then, please. And if the questions can be quick and the answers can be quick, then we will not strain people's time.
Thank you. The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hey, thanks very much for the going into overtime here. I really appreciate it, you guys. Just on sorry, I think it was slide 17, where it shows the provinces. So the gray line, current levels of transmission, like it looks like Ontario and Quebec are already on pace for this. Quite a resurgence, as you say, that looks even consistent with the Omicron replacement. So am I reading that right, that these 2 provinces are on pace already, given what's going on now, for this strong resurgence? And if so, does that mean that stronger health measures are needed in these 2 provinces to get off this resurgent trajectory?
Yes, Teresa Tam. So if you also refer back to some of the slides at the beginning, it shows that Canada's case rates are going up, mainly driven by the 2 largest provinces, and those are cases. And so I think the provinces are also looking at hospitalizations and the other impacts. And if you unpacked the numbers even more, right now, those cases are in the youngest age groups, schools, and daycare, which we subsequently demonstrated. So I think, they've been looking at all of these parameters together, not just the case rates, in deciding what kind of public health measures are reasonable in their context. But I'm just urging extreme vigilance and caution, because the Omicron variant could take over pretty fast, and we don't know what the impact is on the severity indicators or on hospital capacities, and that might be different in different jurisdictions. So what you see, the projections there are for cases, but there are other considerations as people take into account their policies. But any escalation in cases could result in more hospitalizations.
And just quickly as a follow-up, I know you guys have been asked this a couple times, I think in French, sorry, it's a blurring in my mind here, but you say small gatherings over the holidays. People should go small. I heard reference to 20, 25 people. Is it kind of a region-specific thing in terms of a cutoff, or what would you guys say, just to be super clear to Canadians who are planning dinner parties and stuff over the next few weeks? What does small gathering mean?
Yeah, so you're right in that we always stress that you should look at the local epidemiology. So if you're doing your personal assessment of what you should do at Christmas, first of all, make sure you know what's happening in your community and know that that could change. So have other plans. You know, if you had one plan, you should maybe have other plans like Plan B, because by Christmas things could look quite different, but plan for different eventualities. Right now, with the Omicron variant and some of the knowledge we still have to gain, to be prudent is good to keep, I think, gathering small. And by that, we're not prescriptive. We just said, let's think about families and your close friends where you know the vaccination status. That is the safest thing to do. But it does depend, as you've seen, it's very different in terms of disease activity in different areas of the country. But I just think that given the Omicron variant, if we can all do our part in reducing the risks of transmission for now, while we're learning things, that will be our collective effort to minimize our risks. I think provinces will have different policies, but I think we can all think of our particular situation, do our best in minimizing these risks. There have been super spreading events with the Omicron variant from other countries. So, and those were different kinds of gatherings, not your family ones, but they're more, but some of them have been potentially, social gatherings. Others are conferences or events like that. So I think anything to avoid a super spreading event is prudent at this point.
Thank you very much. Operator, next question. Prochaine question.
Merci. The next question. La prochaine question est d'Annie Guillemette, Cogeco Nouvelle 98.5.
Question from Annie Guillemette. Over to you. Thank you. My first question has already been answered. What about traveling during the holidays? Do you recommend people stay home and cancel or not book a new trip in the midterm because of the high transmissibility rate of the new variant? Answer, Dr. New. Thank you for the question. Here's what I can tell you. It's very important to carry out a self-assessment. We know that if, for example, I'm a senior citizen with underlying health conditions, it is strongly recommended not to travel abroad. We know that the situation in Canada is good compared to that in other countries because we have good vaccine coverage and most Canadians follow public health measures. But we see that the pandemic is continuing across the world. And if one decides to travel abroad, number one, the person must be fully vaccinated. and should also take into account underlying conditions or other factors applicable to that individual. Once someone goes to another country, they must be aware that the health measures can change at any time in those countries. So it's important for people to stay apprised of the requirements as they're evolving in the country where they travel. They need to keep tabs on what the public health measures are, for example. This could have an impact on what the individual may plan to do during their trip. Should they, for example, stick to outdoor activities such as hiking, or were they hoping to participate in indoor gatherings with other people? So that should be factored in. Turning back to Canada, we are continuing with measures at our borders. For example, testing, quarantine, etc. And those measures can change here in Canada for travelers arriving from abroad. It is not for me to say whether someone should travel or not, but I do urge people to be aware of all the risks here in Canada and abroad. Thank you.
Merci. Operator, last question.
Thank you. Merci. The next question is from Christine Barak from CBC National News. Please go ahead.
Thanks, doctors, for taking our questions. Just quickly, we know that some Canadians are really scrambling to buy rapid tests right now. Do you have any advice on using them? And Dr. New, you mentioned you're having a small gathering. Would you ask people to take a rapid test before they attend or not?
It's Dr. New. I guess maybe I should start if there was a question for myself. I'm sure Dr. Tam has lots to say. Not to get into all specifics, we always talk about using the right test in the right place at the right time. And so not to get into all of the details between what we call rapid antigen tests, which have a certain characteristics in terms of what I might call sensitivity, specificity, and then, of course, the molecular tests, which we know also have certain attributes which make it, I would say, maybe at the end of the day, more precise in being able to give a diagnosis. And so for rapid antigen tests, I would say that there are some key considerations because of I would say, the drop-off or the fact that they don't work, I would say, as well as a molecular test, that they need to be used in the very specific situations. I think the minister already mentioned that in certain contexts, if you're doing a sort of regular testing, let's say in certain workplaces, maybe in schools or whatever, there might be a possibility of that being useful. I would say also that, if you're trying to rapidly deal with outbreaks, if you have the beginnings of an outbreak in terms of maybe rapidly identifying what the spread might be in certain situations, then yes, the use of rapid antigen tests. For me, in terms of my personal situation, I think, whether they might have any utility. First of all, I can tell you right now, I fully expect that all of the guests at my family get together are fully vaccinated, and certainly also clear instructions for myself included. We might cancel it because I'm the host, and if anyone's coming down with symptoms or feeling ill, you shouldn't be coming. So that I think is number one, and we certainly know that the rapid tests have a certain use. If you are ill, then it's maybe a quick way to determine whether you might have COVID-19. Obviously, maybe to be then confirmed by a molecular test. So to me, I guess quite honest, I don't anticipate using them in my personal context, because it's really, if you get the greatest yield in terms of determining, if you have COVID-19, if you're symptomatic, my first stance is that if you're symptomatic, you have any signs of illness, no, you shouldn't be coming to my family get together. So hopefully that answers part of your question, but I'll turn it over to Dr. Tam for anything else she would like to add. Thanks.
Mm-hmm. I would just say that, if you use a rapid test, it should be an additional layer and not let go of some of the other layers of protection that we've been talking about, and know the limits of the rapid tests. And so that's I think before anyone uses a rapid test, just learn about it and learn what it can or cannot do. And that if you tested yourself today, there are false negatives, but you take that into account. As I said, if it's just part of one layer of protection, that's one way of thinking about it. From a sort of national perspective, this is not a limitless resource either. So I think if you're looking at public health programmatic perspectives, as Dr. New said, there are other considerations and making sure that we target these tests in the best way possible. For personal use, just make sure you know that these tests are not perfect. And if you think you need to get another test after the serial testing can reduce false positives as well. So you should take into account your personal context and what kind of gathering you're having, who's there, etc. But it shouldn't be seen as a substitute for the other layers. Thanks.
Yeah, it's Dr. You just to add to what Dr. Tam said. I think it's another layer of protection. So it's a bit of a shout out to, I guess, the family members are coming over for our holiday get together. Bring some additional layers of clothing because I plan to also use ventilation to the max and have the windows open for a certain period of time, maybe on the hour, to also improve the circulation of air. So that's maybe a bit of a warning to my family members who are coming over. Thanks.
Thank you both so much. You've answered all my other questions.
Thank you so much.
Bye.
Thank you to Dr. Tam and Dr. New for taking so much time to answer all of our questions.
Dr. Tam and Dr. New, the top doctors at the federal level in Canada, answering lots of very interesting questions about the COVID-19 situation in Canada. For more, let's bring in the CBC's Evan Dyer in Chelsea, Quebec. He's here to help us recap. So lots to talk about, Evan. A cautious but relatively positive take from federal officials. It's really interesting for them to keep saying, look, yes, we know Omicron is here. Yes, we know